In 2015, Apple released an open source framework which enables the users to develop different apps that are useful for medical research, and it is called ResearchKit. With the aid of electronic gadgets, researchers may conduct surveys and analysis remotely. They may gain access to the enormous database which provides more accurate information for their research. 1 year later, Apple launched the Care Kit, which is a software development kit that allows the users to build apps that keep track of the user's health condition. With a total of 6 modules embedded, each of them connects the users with healthcare services. When the ResearchKit emerged in the market, it appears to be lacking of attention of this open source among the society, since the attention falls on the other functionality of Apple's electronic gadgets or other apps. As an open source framework, Apple created a platform for the developers and researchers to utilize the user base for medical investigations. According to the statistics posted by Apple, over 8 billion of Apple devices in the world are active in 2014. Users of different nationality, sex, and age groups can create tremendous amounts of health figures, which are useful for researchers. The ResearchKit contains various types of data collection related to human sensation, such as our voice or memory. Developers may also expand the research methods by creating new modes on the basis of default template. Simultaneously, ResearchKit is linked up with HealthKit, which allows the researchers to receive statistics from users such as daily mileage, calories, and heartbeat rate. All data are stored in hard disks, which can be extracted for analysis anytime. The collaboration between researchers and users enables advancement in healthcare industry. This may help identifying the solution to different diseases as well as assisting the patients to manage their health condition.
This part I'm going to introduce the advantage of ResearchKit comparing to the traditional research method. In traditional medical research, researchers always face two main problems. The first one is inadequate volunteers for medical studies. Actually, lots of people are glad to be one of them. However, the venues of experiment are always far away from where they live. The tests are also exhausting and cost them a lot of time. It then leads to another problem, which is limited understanding to the disease, because there are not enough cases to study and data to make an accurate determination. The appeal of the ResearchKit can tackle most of the problems mentioned before. It provides simple and straightforward diagnostic tests like tipping fingers and recording voice messages, which is so easy that even a child can do it himself. The test can be developed by the device built in the phone, so people can do the test anywhere with just an iPhone. With over 700 million iPhone users around the world, researchers can collect data from people over different countries and with different diseases. With the help of this convenient framework, more people are encouraged to be one of the participants of medical research, so researchers can get more data from patients and achieve deeper understanding of the disease, such that facilitates the research process, which is the main goal of ResearchKit.
The ResearchKit and CareKit seems very good, so I'm now going to evaluate the efficiency and reliability of them by the concept of the clinician and patient factors. There are mainly 5 factors. The first factor is good decision making. ResearchKit and CareKit can integrate a large amount of medical information and provide good predictive analyticals. However, the suggestion is given by the database. It is not a personalized and effective decision making, and we don't know the ability of the patient to make decision is good or bad. The second factor is accurate diagnosis. There are some concern about the quality of the built-in sensor of smartphone. Moreover, while using camera to capture the eye skin color for an analysis, the eye color and skin color may vary under different environment, thus leading to inaccurate diagnosis. The third factor is the patient compliance. CareKit is quite good in the efficient in encouraging patient compliance because the apps can provide some entertainment games, and it can accomplish the patient to do the work he or she wants. The fourth factor is the effective monitoring of the conditions. It is easy and accessible for the user to use their apps to monitor their body every day. However, it's highly depending on the patient's discipline. Finally, the fifth factor is the accurate interpretation of clinical results. The apps can present the data in an easy and understandable way and manner. However, the users still do not have inadequate medical understanding in order to make the most precise decision.
However, there are still limitations and challenges of ResearchKit and CareKit. First is the accuracy of data. The data are collected from the users from their phone through the apps, so it is not a face-to-face data provision. That means the data provided may be faked because the data are not verified. For example, they can provide fake age or fake gender. Furthermore, the data collected is disproportionate. It is because the apps is only run on iOS system. iPhone users doesn't represent the general public because currently there is over 80% of the phone in the world are running Android system. Secondly, the data security problem is also a concern. It is because there is no back-end database. Also, the data are transmitting from the apps to the server without any encryption. It will be a very serious security problem if the hackers hack the data for bad use. Thirdly, as I mentioned, there is cross-system barrier. Because the apps is only used in iOS system only, incontinuous data collection will happen if the users change their phone from iPhone to Android phone. Last but not least, there are already many well-developed competitors in the market, for example Metadata and ProofPilot. What's more, these apps provide more professional data as they cooperate with the local hospital and collect experimental data from the patients.